each part, you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a physician talking to a new patient, called Mrs. Delilah. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, doctor.
Yes, Miss Alyssa. What's your problem?
I'm getting acne from continually washing the area around my chin, right temple, and left temple, and the condition is still worsening.
What's your age?
19.
How old were you when you started your period?
Well, it was when I was 13.
And can you describe the length of your cycle?
Once in 24 days, and it lasts for almost 6 days.
Would you describe the flow as light or thick?
It's light.
Do you use any medication?
Yeah, I take the oral contraceptive pill.
Are you allergic to any drugs?
Yes, allergic to penicillin. I feel difficulty in breathing.
What are the medicines you are taking?
Alisi 28, 20 mcg, 0.10 milligram tablet.
Is anyone in your family prone to any disease?
Yeah, my mom has stress disorder and anxiety.
Do you smoke or drink?
I don't smoke, but I drink socially.
You drink caffeine?
Yeah, 4 servings a day.
Your diagnosis report shows you have symptoms of periodic reddening of face, acne problems, and allergies. And a diagnosis of epicrine and apocrine glands shows no evidence of hyperhidrosis, chromhidrosis, or bromhidrosis. But your face shows keratotic papule. I would suggest you go for antibiotic therapy. Take a tetracycline, 250 milligram capsule. I would also suggest you take an oral antibiotic therapy with doxycycline, 100 milligrams a day.
Doctor, why does the acne occur?
Acne is a skin condition that happens when your hair follicles become clogged with oil and dead skin cells. It often results in blackheads or pimples, whiteheads, and often appears on the face, chest, forehead, chin, shoulders, and upper back and shoulders. Acne is most common among teenagers, like you. The androgen hormones increase during puberty, causing the sebaceous glands to enlarge and secrete more sebum. Hormonal changes during pregnancy and the use of oral contraceptives also impact sebum secretion. Moreover, low amounts of androgens circulate in the blood can still worsen acne. Medications such as drugs containing corticosteroids, testosterone, or lithium worsens the disease.
Which food should I avoid, doctor?
Certain dietary factors, such as skim milk and carbohydrate-rich foods such as bagels, bread, and potato chips, worsen acne.
Can you recommend any effective foods for acne?
You must stop eating processed sugar, caffeine, dairy products, and processed foods. And you should include foods that are rich of antioxidants, anti-inflammatory compounds, and other acne-fighting nutrients. Foods such as blueberries, sweet potatoes, green tea, carrots, cilantro, spearmint, oats, apples, barley, and mustard greens.
Okay. Thank you, doctor.
Thank you.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. I've got an appointment with Dr. Gonzalez at 8:30.
Okay. Please be seated. Let me check with your record. In the meantime, please sign in and be seated. Margaret Nicholson?
I'm here.
Follow me to room number 3, please. Here we are. What's the reason for your visit today?
Well, lately, I've been feeling really tired, and often I get frequent headaches and an upset stomach. Moreover, I've been getting a persistent cough for like the last 3 weeks.
When did these symptoms start?
I started feeling tired all the time about 2 months ago. Then, a few days after that, the headaches started. I got the upset stomach long before feeling the tiredness.
Are you taking any medications?
Only vitamins.
What vitamins are you taking?
I am taking vitamin C, and a multivitamin tablet daily.
Okay. Let me examine your vital signs.
How am I doing?
Everything is normal. No high temperature, and your blood pressure is also normal. Please wait for a moment here.
Thank you, doctor.
I see here that you have started feeling tiredness 2 months ago, and then frequent headaches. You're also suffering with an upset stomach and a persistent cough. Did you run a fever as well?
No, doctor.
Let me perform a quick physical checkup. Take a deep breath, hold your breath for a moment, and exhale. Repeat this again. Have there been any changes in your diet or your weight recently?
My diet is the same, as usual. However, I lost 5 pounds very recently.
Did you ever suffer from insomnia?
Well, it is pretty hard for me to fall asleep. I also wake up often during the night.
Do you drink or smoke?
No, doctor. Well, recently, the ownership has changed, and I had to work a lot of overtime at late hours, even during the weekends.
I think you are suffering from pneumonia. Other than that, I do not see any other problem. The reason could be probably the stress at your workplace that causes headaches, upset stomach, and sleeplessness. For now, try to relax yourself and start doing exercises. Meet me again after you receive all the medical diagnosis reports. I'm going to prescribe medicines for bacterial pneumonia. Are you allergic to any medicine?
Not to my knowledge.
I want you to do a blood test and urine test to identify the bacteria Streptococcus pneumoniae and Legionella pneumophila.
Is it something serious, doctor?
Not at all. I doubt that could be bacterial pneumonia. Take levofloxacin, 750 milligrams orally, every 24 hours for 7 to 14 days.
I want to know my cholesterol level. When will I get the medical reports, doctor?
You will get the medical results in 2 weeks. Don't stress yourself. Everything will be okay.
Can pneumonia be prevented, doctor?
In most of the cases, pneumonia can be prevented. You can have a vaccine to defend against pneumonia once you get all these medical investigation reports. I would suggest Prevnar 13 pneumonia vaccine. That is very effective against 13 types of bacterial pneumonia.
What food should I include in my diet, doctor?
Have plenty of fruit juice and fresh fruits, yogurts, milkshakes, smoothies. Eat plenty of full cream milk or yogurt, or even ice cream, with light meals of lean meat, fish or eggs, and cooked vegetables.
Thank you, doctor.
You are welcome.